time for the Senior Scoop with Bob and Maria.
Well, good afternoon, everybody, and welcome to the Senior Scoop, the show where information meets inspiration and something a little bit of a perspiration as well. Because today's topic might be something that you guys squirm a little bit about. But that's okay, because you know what? We're going to be talking about the things that most people kind of avoid, put off, and pretend aren't happening until suddenly they really matter a lot. So today we're going to be diving into colorectal cancer awareness. Very good, very good. And hearing loss and how it impacts your everyday life. So before we do that, though, Maria, how are you?
I had a crazy morning. I didn't get to work until 10 o'clock. So
Really?
Yeah.
What happened?
I went on a Zoom call at 8:30, but I did not get dressed. Okay?
Okay.
So I just was in my pajamas on the couch, like most Zoom calls, just turned my picture off.
Right.
Then I went to get dressed because I knew what I was wearing, but I lost 8 pounds and my pants were too long.
Look at you.
So
These are real good problems to have, you know.
I know, but I had to find something else to wear, which takes me forever.
Jeez. That's
So,
amazing.
yeah.
But you're here now.
I'm here now, so.
And it's March. And
It's March,
it's like-
and we have a great show today. And as Bob said, next month is our 1-year anniversary.
I can't believe it.
It started in a bar.
It did, which is very fitting, being St. Patrick's Day month here. Yes, most things do. So. But no, I'm excited for today. I have to tell you, our partners over at CMC, I had another visit. Yeah. I've been spending a lot of time over there that I didn't want to, but man, they're really great over there. And
Absolutely.
I will tell you the one thing I got to say, and I know it's a little off topic, but if you guys didn't know this, it's really important that you can actually choose your hospitalist. And I know that the guy's got to be the busiest guy in the world, but the best hospitalist I've ever met in my life is Dr. Patil, Patil. He is the man. And I got to tell you, we were really happy to have him. He was the first person in over a year and a half. So my dad sometimes passes out. I'll be honest with you. We always thought it was because he was drinking too much, but it wasn't. It wasn't. We did find out that when he sits on a stool, he actually is cutting off circulation by sitting on a nerve, and it makes him pass out. And what happens is his body goes into shock, and it tries to force the blood to his brain, and he kind of goes into like a little, not a seizure, but he kind of goes out. Yeah. Well, this has happened quite a few times, and I'm embarrassed to say when it happens around my family, we're so used to it, we know just get him out of the chair, lay him on the ground, he'll be back in a couple minutes. Yeah. I'm not even kidding, guys. So it's and then he comes back and he's ready to go. But it happened at Donovan's, actually.
Yeah, down the street.
Down the street here, and there was an off-duty police officer, and he was great. He jumped right into action, gave my dad CPR, because it looks like he's totally not breathing. But this is the first time in a year and a half, 7 trips to the hospital, that they didn't just say, drink some fluid and go home. First time. So this is the first time that they did tests. They did a table test where they put him to see what was going on. They checked the, the circulation, the carotid artery to see that they did an ultrasound of that. So for the first time in all this time, my dad, yes, the thing is that, like the doctor said, the good news is we've ruled out all the major stuff. Yeah. The bad news is you're going to have to travel with a pillow, because if you're sitting on a bar stool long enough, you're going to go down. So I'm really excited and I'm very thankful. And I did learn that little tidbit. I think that there's a lot of stuff when you're at the hospital that you can actually choose that some places might be forcing on you. And I think it's important just to ask, whenever you're at these places, to find out, because the difference between Dr. Patil being our hospitalist and anybody else is why we have some answers. So major props to good old Community again. I'm loving this place. I just don't want to go as much, I'll be honest with you.
I know. And I just want to mention, next month we have a really good show. So as we said, we've been doing this a year. And throughout this year, we've met many great doctors from Community Medical Center. But we had... it's actually my sister who had a diagnosis of lung cancer, who we had Dr. Whitlark on the show. And when she received this diagnosis, I had called him, and we had a full circle. So she had robotic surgery. It was literally amazing. In on a Friday, out on a Monday. the process was seamless at Community. And so next month we have the doctors who helped her through this.
Oh, that's awesome.
And she's coming on the show too.
That's exciting.
And it's just amazing that the information we received from the show was able to help us through this pretty traumatic diagnosis.
Yeah, and I got to say, I mean, because when you called me, I don't want to go too much into it, but the excitement and how quick and all of that, it really is amazing stuff. Yeah. So that's going to be a lot of fun. But before that, we got a really cool show today, and we're going to have a little bit of fun. So you know what? We will be right back with our first guest, Dr. Paul Jennings from good old CMC. So we'll be right back, everybody.
You're listening to the Senior Scoop with Bob and Maria. Thanks for joining us, and we will be right back.
Welcome back. You're listening to The Senior Scoop with Bob and Maria.
All right, everybody. Well, our first guest is someone who quite literally helps save lives every single day, often by helping people face something that they'd rather not think about or talk about. Now, Dr. Paul Jennings is a board-certified colorectal surgeon affiliated with Community Medical Center right there in Toms River. And he's completed advanced fellowship training at Brown University and specializes in colon and rectal cancer, minimally invasive surgery, and complex digestive conditions. But what I love the most about learning about Dr. Jennings is that your patients consistently describe you as calm, clear, and compassionate, which is something that we have seen all over Community, and we're excited to meet you. Yeah. So thank you, Doctor, for joining us. Everybody give him a big round of applause out there. So welcome to the Scoop, man. How are you?
Thank you very much, Bob. Very happy to be here. Thank you for having me, and you're making me blush with that description.
Well, you know, I tell you, it's actually what we ask. I've got to ask you though. All right, starting right off, what made you go into this end of the business?
That is a question I get a lot. Specifically, you know, when people come to see me for something like hemorrhoids, I have them on the table, their butts up in the air, and they're like, why do you do this? Why have you chosen to do this? And no, I mean, it's a valid question, and it's a great field. I did my general surgery residency at Monmouth Medical Center, not too far from here in Long Branch. And when you're a general surgery resident, you get to sample a little bit of everything. Vascular surgery, thoracic surgery. I worked with Dr. Whitlark actually when I was a resident.
Oh, nice.
Trauma surgery. So it's a process of a mix of finding what you like and also a process of elimination, what you don't like. Mm-hmm. And I found my way to colorectal surgery. All of the residents in my program did a 3-month stint at Memorial Sloan Kettering Hospital in Manhattan. Which is an amazing place. Obviously, it's unique. It's world-renowned. And I spent 2 of my 3 months there on the colorectal service. And I got to see some really impressive doctors do some really amazing things and make a real difference in people's lives. Because colon cancer specifically, especially with all the screening we're doing now with colonoscopies, when caught early, is a cancer that can be treated with surgery alone. Whereas, you know, a pancreatic cancer, a lung cancer, a lot of the patients are getting surgery. They're also getting chemotherapy, radiation, which takes a toll on the body. So it's satisfying for me to be able to help all these people out, you know, get them through their disease with surgery alone. And, you know, they say pick the field where even the not so glamorous cases don't bother you. Right. So the not so glamorous cases don't bother me.
Well, you know, and I think it's really a testament too, because it is an uncomfortable thing for people. So, I mean, to walk in and you be calm and fun about it. I mean, it's got to be, every day is a little bit different, you know, and I'm sure your first time that you're meeting with your patients, that breaking down that wall has got to be a part of it, where maybe some other medical professions, it's not as much, you know, but you have to get past to tell me the real deal, what's going on, right?
Yes, you definitely have to put people at ease. And I will say surgeons, whether fairly or unfairly, I think broadly have a bit of a reputation of being a little intimidating, perhaps, especially within the medical field. But every colorectal surgeon I've ever met has a great sense of humor, because you have to. And you have to definitely be a little disarming. People have to feel comfortable, because it's an inherently uncomfortable thing to talk about. Yeah. So you have to make people be comfortable with an uncomfortable scenario.
Yeah. So you know, when we talk about that too, I mean, when should someone actually start really look into screenings and like what, if if you've never spoken about this before, like my cousin, actually 40 years old, she had colorectal cancer, and same thing, she had the surgery and she's doing great,
Great.
But that was when it came up in my family, it was very strange because she's 40 and, it was out of nowhere. So what would you say to, your friends and your family? When should you start looking and what should you do about it?
So this is a hot topic in medicine, and the guidelines have changed recently. So colorectal cancer screening, and mind you, screening is for people who are feeling totally healthy, no symptoms, not having any problems, no risk factors. So that includes people who do not have a family history, their mom, dad, brother, sister doesn't have any colon cancer, and for people who don't have a personal history of cancer or polyps, right? So you're feeling totally well. Those are the healthy people that we want to get in to find a problem before it becomes a problem. Right. It used to be 50 we would get people in. That guideline has changed in recent years to 45. Why has it changed? Because there has been an uptick in recent decades in colorectal cancer in young people. It used to be pretty unheard of to get colon cancer in your 40s or sooner, and that number has unfortunately been on the rise. In the news, you may have seen Chadwick Boseman, the guy who played the Black Panther, died of colon cancer, unfortunately. Just recently, James Van Der Beek, another famous actor who had stage 3 colon cancer. And these young people who are getting this disease, it doesn't behave quite the same as it does with the older folks. It's more aggressive because there are delays in diagnosis, because we're not so much screening them, and young people, it's not so much on their radar to recognize the alarm symptoms and to come in. When it's diagnosed, it tends to be at a later stage, so it's harder to, they're not going to be those people who are necessarily cured by surgery alone. They may need some additional treatments, and so that's a tough problem that we're grappling with right now. But the guidelines have changed for screening from 50 to 45, so we're trying to get people in. And as a result, I am a lot of fun at parties because I find myself discussing a lot out of work. And by the way, have you had a colonoscopy? And that's not what people necessarily want to be talking about, but that is what they end up talking about with me. So
that is funny. And you know what are some of the what are the symptoms? So if you're healthy, you're 45, go get it checked out. But what are the you better go now symptoms?
Sure. And I want to talk about definitely for people who are a little older, what symptoms they should be looking out for. And also, I'm sure there's people in this room whose kids are now the age that it's time to go for colonoscopy. So it's important to know. I would counsel people that beware, and I say the same thing to medical doctors who ask me the same question. I say beware of just hemorrhoids. For those who are listening, I did air quotes on that. Because people will say, I have something going on down there. It hurts, I have some bleeding. And, if you're in a doctor's office, not for that, if you're in, seeing somebody for something else, they may be hesitant to say, well, pull down your pants, let's take a look.
Right.
Reasonably so. But be wary of just hemorrhoids. A lot of people will ignore their symptoms, delay getting in to see the appropriate person to get worked up. If you're having blood from down there, blood in your stool, it's not normal. And most commonly, it probably is going to be just hemorrhoids. But how can you know for sure until you have someone take a look and make sure that it's something common? Because this is especially true for young people, but older folks are guilty as well. You hear, it's just hemorrhoids. Everybody has hemorrhoids. That's pretty common. And they tend to ignore the problem and let it go on until it can no longer be ignored. And then it's harder to deal with.
And it is a colonoscopy. That's how you find out. That's the big test. That's the screen right there.
Colonoscopy is the gold standard best test. Reason is it's a camera, so it allows us to look with our own two eyes, and it's also both diagnostic and it can be therapeutic. So at the time of colonoscopy, we can look for things that look abnormal. We can remove precancerous polyps right then and there. And I always tell people a polyp is much easier to deal with than a colon cancer. If you can have it removed right then and there, not have to go through an operation, why wouldn't you want that? You can take biopsies of things that are suspicious. So you say, hey, that might be a cancer. I'm going to take a piece of it and find out. And those biopsies also inform not only what the diagnosis is, but there are certain tests we can run now on the cancer itself to see what kind of treatments it will respond to. They test it for certain gene mutations, what chemotherapy will be effective, what immunotherapy will be effective. There's even a test now where we analyze the tumor's specific DNA, and they use that as a blood test to screen for recurrence of the cancer after you've been treated. So they can test and see if tumor DNA has shown up in your blood. And if it does, then they say, we got to get you in. We got to go looking for something else.
Wow.
And that's all obtained at the time of the colonoscopy. So it's extremely important. Now, there are alternatives. There are other tests. You guys may have heard of Cologuard, right? Cologuard, everybody's heard of that?
Mailman's favorite thing.
Everybody, I'm sure you watch a football game, you see the little dancing white box.
Yes.
He looks so happy to receive
Right,
the sample
right,
that
right.
he's going to get and then go off through the mail to be analyzed. And I totally get why Cologuard is appealing, because you can do it in the safety and privacy of your own home, right? You don't have to go show any nurses your butt, which is
Right.
nice. I get it. You don't have to take a bowel prep. So that is for those who don't know what a bowel prep is, when you go for your colonoscopy, you got to drink that big jug of stuff.
Awful.
Nobody likes it. You're going to be chained to the toilet for a day, and that's to clean you out so that the camera can see what it has to see. So Cologuard does not require that. So you can see why people would jump at that. However, the reason Cologuard is not a perfect test is because if it is positive, you got to get a colonoscopy anyway. And there is a concern with false negatives, meaning the test will show negative, but it's missing something. And that number for colon cancers is 8%. It misses about 8% of colon cancers.
That's not good.
And for those polyps, it takes a polyp in a normal person who doesn't have risk factors or a genetic condition. It takes a polyp about 10 years on average to transform from a polyp into a cancer. So it's sitting there for a good long time, slowly getting bigger, slowly becoming more irregular. The Cologuard test misses 54% of those advanced polyps that are at risk to become a cancer.
It's funny too, because that's actually was one of my follow-up questions because it's one thing to start screening. Then what though? Do you go every year? You go every 5 years? So 10 years?
10
Is that?
years, right? now?
It depends. So if you get a totally clean colonoscopy, the best case scenario, no polyps, no nothing, you're good for 10 years.
Oh.
That number comes down depending on if there are abnormal findings. And it's based on the number of polyps, the size of the polyps, and when we remove them, we send them off to the pathologist. They slice them and dice them and look at them under a microscope. And there are certain high-risk findings in the pathology report that we get that if those are present, we move that up. So it may be 5 years, it may be 3 years, it may be 1 year, it may be 6 months.
Okay.
Or it can be, hey, we found something that requires a surgery.
Yeah. Can you do anything about that prep? That is the worst.
So we have made some progress on that as well, actually. So it's on the more recent side, the classic prep, and there are multiple options, but it's the big jug of liquid that nobody likes. So there is a pill version now.
Oh, really?
Yes, it has the same effect. I can't get you out of that, unfortunately.
That's fine. But that's
because
the,
we need you cleaned out no matter what. Otherwise, you're going to end up right back seeing me again. But there is a pill version. It's called a SUTAB prep, and it involves 24 pills total. You have to take 12 pills with water the day before your procedure and 12 the morning of, depending on the timing of your procedure, about 8 hours before. So if you're in the morning or the afternoon, it could be the middle of the night. It could be the morning.
Wow.
It's better than that citrus of whatever.
Yes, and I can tell you, my mom has had to go for many a colonoscopy. She was on the 3-year plan for a little while. She was so excited when she got told after her most recent year she can go to 5 years.
Ooh.
That was a big win for her.
Bingo.
But she always had a big struggle with the liquid prep. She always got very nauseous.
Yes.
She had a system for a while that involved gummy bears, where she was drinking a cup of the fluid and popping a gummy bear in her mouth. The most recent time she did the pills and found it helped her nausea and helped her tolerate the prep much better.
Yeah.
So, when you're going for that colonoscopy, if that is a bug in the back of your mind that, I got to drink that liquid, you can ask for the pill version and they should be able to accommodate you.
Nice.
Now, one of the things that's, and we're going to be talking about it on our next episode, but there's been a lot of advancement, especially over, at Community. They've been doing a lot of cool stuff. And you just talked about how there have been some advances as well. Is there anything that you're excited about, down the road when it comes to this, like robotics or things, anything that you're pretty pumped about?
Absolutely. So I will say when I was a resident at Monmouth Medical Center, we did some robotics, but I think it was kind of on the up and coming at that point. So we also did a lot of open surgery when I was a resident, so making a big incision, and we did a lot of laparoscopic surgery. Then I went and did my fellowship at Brown where we did a lot more robotics. And now at Community, I'm very blessed to have a lot of robotic resources available. I've not had any issues when it comes to scheduling my cases for when I want the robot, I can get the robot, which is nice. Because it's minimally invasive. You can get it. You can have a big 3-4 hour operation where you remove a third of your colon and come away with a couple of incisions about yay big. And then I always tell people we have to get the colon out of there, and it's not going to fit through a hole that's that big. So there's going to be one that's like that big. But that's still it beats going from stern to stem, as they say. So I am very excited about the robot. The nice thing about it compared to laparoscopic is the visualization is much better. The camera that we use actually has 2 cameras. So there's a right eye and a left eye to give you some depth perception and some 3D when you're in there, as opposed to the laparoscopic where you're kind of looking at a 2D screen. It also has wrist articulation. So unlike laparoscopic where you're working with straight sticks that open and close, the robot can pinch, it can rotate, it can articulate, which is really helpful for when you're working in a narrow little area like the bony pelvis. You're confined to that area. So for rectal cancers especially, the robot is quite helpful. For certain very early, very small rectal cancers, they can be removed out even without going through the abdomen. It can be a transanal operation. And there is even a robot now, it's called a single port robot, that can help do those transanal resections of the early tumors. So without any incisions at all, that's for very specific tumors, but we can go in through the bottom and get it out that way.
That's unbelievable.
Yeah.
I mean, so is there anything you can do? Is this like a lifestyle thing? Is there anything, the way you eat, the way your lifestyle that can prevent this or at least keep it at bay?
Yeah, that's a great question. So there are certain risk factors that you can't do anything about. Your family, you don't get to choose your family, right? We all know that. If your mom, dad, brother, sister has a history of colon cancer, then you are at higher risk for colon cancer. In those individuals, we actually don't start at 45, we start at 40 or 10 years before your family member was diagnosed for screening. There are also certain genetic conditions that predispose you to colon cancer where it's almost a guarantee that you're going to get colon cancer. Those are rare. But there are certain conditions where we start screening as early as 12. So that's an unfortunate situation. We don't see that commonly. So those are things you can't do anything about. In terms of modifiable risk factors, so things that you do have a hand in, things that you do have some power over, the most common one is smoking. We know nowadays it's been enough time that we know smoking is bad for us in a whole slew of ways, not just affecting the lungs and your ability to breathe and get around, but it increases your risk of cancer just about everywhere, and that includes specifically colon cancer. So that's a risk factor that you can control, cut down on it, reduce your risk. Likewise, men, unfortunately, are at a higher risk than women. There's not much you can do about that. Being overweight and a sedentary lifestyle increases your risk of colon cancer as well. So stay active, be healthy, get to the gym, do the things you can do. If you needed a little extra motivation, avoiding colon cancer is a pretty good one.
That'll work.
Yeah, absolutely.
And regarding diet, the things that have been found to be associated with colon cancer are a low fiber diet, which unfortunately in the West, so this hemisphere of the world, we all eat a low fiber diet because of just the things that we like to eat. So those leafy green vegetables are helpful. And as well, it's very difficult to get all the fiber you need from your diet alone. So there are dietary supplements. Those are your Metamucils, your Benefibers, those lovely powders that you can dissolve in water and drink in the morning. And that also will reduce your risk of colon cancer. And avoiding red meats, processed meats, and smoked meats so like barbecue, unfortunately, it's delicious.
Ribs.
As my mother says, everything in moderation. But if you can, modify some of those things out of your diet, you are reducing your risk long term.
I just have one question, just to step back a little bit about the polyps. Do all polyps turn into cancer eventually?
Great question. Not necessarily.
Okay.
So polyps come in all different shapes, sizes, flavors. There are, like I said, we send them off for those that pathology analysis, and there are certain characteristics that we look for. So there are things called hyperplastic polyps that are really not of a concern for colon cancer. Then there are adenomas that we think are more likely to progress to cancer over time, that 10-year period. And within those adenomas, they look for certain pathology, certain high-risk features. If they say that if you see on a pathology report, tubulovillus or villus adenoma, those are at higher risk. So we're trained to look for those in the report and know that, okay, this is a person who needs to be screened more frequently. So not every polyp needs to be a concern. If they're very small, very few, and of benign pathology, you can stay on that 10-year track. But depending on the size, depending on the pathology report, depending on the number, so if you have, greater than 10 polyps, that's a lot of polyps. We're probably going to bring you back within 3 years. You might be prone to forming these polyps.
Yeah.
1 or 2, small, not that big a deal.
And so what do you do when you're not doctoring?
What
Dr.
do I
Jennings,
do when I'm
what
not
are you trying to
doctoring?
do, man?
That's a good question. So I live in Long Branch on the Jersey Shore. I'm originally from Long Island, so I've always been kind of near the ocean. I love the beach, love the ocean. Love for going for runs on the boardwalk there.
Yeah.
I have been known to run a half marathon or even a marathon from time to time as well, so I'm a glutton for punishment. Yeah. It's therapeutic for me. And I was also back in the day, I was a collegiate swimmer, so I enjoy swimming. That's also
awesome.
Good for my mental health. I enjoy hiking. Yesterday, I was playing pickleball with a friend.
Pickleball's the best.
Yeah, pickleball is awesome. So I highly recommend it. Very accessible. It's something everyone can do. I love meeting up with friends, staying active, getting out into the beautiful state that we all live in.
Yeah, Long Branch has some good places over there too. That whole little area, but McClune's and everything else.
Absolutely.
Concert series coming up.
Yeah, absolutely.
That's listen. I love that you're here, and now it's time for a little game time. I'm sorry to tell you, but this is just something that we love to do, and here it comes.
It's game time.
All right, so now, Dr. Jennings, we're going to play with our audience. We're going to see how attentive they were. So I'm going to ask them a question, and then you're going to back it up to see if it's correct or not. If you get it wrong, don't worry about it. We will edit this. All right, so here we go. All right, now, I've got a couple here, and I think we reviewed a few of these, but let's just see how this works here. So, which of these 4 is the best for your colon health? Is it A, fiber, B, hydration, C, exercise, or C, finally answering your spouse when they talk to you? So do you think it's fiber, hydration, or exercise? Guys, fiber, hands up. Ooh, exercise, hands up. Hydration, hands up. Doc, how'd they do?
Is there an E, all the above?
Well, it should be all of the above. But out of those 3, which one is the best? Is the fiber the best?
I would say fiber.
Well, that is correct. That is correct. That is right. And all did well. All right, now I got another one here for you. What is let's see. Oh, this one is actually interesting. Which food is the worst for colon health? Is it, this is kind of funny. Is it whole grains, vegetables? Is it processed meat, or anything that Maria cooks? Which, what do you think? What do you think we got? Is it the processed meats, vegetables, whole grains, or anything that Maria is cooking? What do you guys think about processed meats? Oh, we don't even have to go any further, do we, Doc?
I mean, I've never had Maria's cooking, so I can't say for certain. But yes, I'm going to go with processed meats.
Excellent. Very well done. And then we got one more. Let's see. Oh, a colonoscopy today is most like medieval torture, a mild inconvenience, a great excuse to cancel plans, or something your friends exaggerate about. I mean, this is pretty simple. But yeah, it's a mild inconvenience. The colonoscopy itself is a mild inconvenience.
It's really the prep that's the inconvenience.
Yeah.
I talked to my dad over the weekend, and he described the colonoscopy as the best nap you'll ever have.
Yeah.
Yes.
So,
No joke. I went in. I got the double. I had to wait a long time so I could get both done, the endo and I loved it because first of all, they take your phone away, which is awesome. Mm-hmm. You're sitting there. I can't even answer my phone. For like that half hour before. I was mad when they came to get me. I really was. I was like, oh man, this was way too short. And then you wake up and time has passed, and it's like, all right. Especially when you get the clean bill of health, which is always nice. But Dr. Jennings, I can't thank you enough for being here. This was really, really informative, and I'll tell you what, you are the man. You are the man. We appreciate you coming. Guys, how about a big round of applause for Dr. Jennings? And we will be right back.
You're listening to the Senior Scoop with Bob and Maria.
Thanks so much.
Thanks for joining us, and we will be right back. The views and opinions expressed on Senior Scoop with Bob and Maria, presented in partnership with Caregiver Volunteers and Harrogate, are for entertainment and informational purposes only. These views do not necessarily reflect the opinions or policies of caregiver volunteers, Harrogate, this station, or their affiliates. The content provided should not be considered medical, legal, or financial advice. For personalized guidance, please consult with a licensed professional. Listener discretion is advised.
Welcome back. You're listening to the Senior Scoop with Bob and Maria.
All right, everybody. Now we move from something that can affect longevity to something that can deeply affect quality of life. We have Dr. Laura Padham as a doctor of audiology serving patients throughout Ocean and Monmouth County. She has a unique approach, bringing hearing care directly to patients, often in their homes or senior communities. Her focus goes far beyond hearing aids. She works on communication confidence, cognitive health connections, social engagement, and emotional well-being. And something I noticed when we were reading about you was that you talk about how hearing affects relationships, which is something that I just don't think we think about enough. Of course, I will tell you, from my relationship with my father, 100%. So, guys, how about a big round of applause for Dr. Laura Padham? Welcome.
Thank you. How are you?
I'm doing great. And this is really exciting. I especially, like I said, I'm very intrigued by this. And like you had said before, this is an episode about some serious things that you really don't want to talk about, but they affect everybody, even if it's just
Right.
you or everyone around you. My father and I have had conversations 7 or 8 times that literally I think he is understanding me, and he's a great faker. And and it comes from years and years of he was a bartender for years and years with those speakers pounding, and it's what happened. But when you talk about the relationships, when you talk about more than just the hearing, and also the confidence, going into a room and hearing so many sounds. So tell us a little bit about yourself, please.
So I'm Dr. Laura Padham. I have an office in Whiting. I also have a practice where we do mobile at-home hearing, either in senior communities or in people's homes. I've been in practice with that since 2019. I worked in senior communities for a really long time. I used to own a lawn sprinkler company.
Oh, all right.
River. And I just got bored doing that and decided to go back to school and become an audiologist.
Wow.
I got my doctorate at 50.
So wait a minute, hold on. So you're deciding you've got the sprinkler business, and you're deciding I want to do something different.
I made better money at the sprinkler business.
Oh, well, listen, I believe it. I believe it.
I'm sure.
So what brought you to doing audiology?
Actually, it was interesting because while I was doing that business, I worked only in Holiday City,
Okay.
Toms River, right? So I noticed so many of my patients they weren't my patients, they were my customers, right? So many people would get frustrated because they either didn't understand the phone conversation of what time I was coming, they could not hear me knocking on the door. I was knocking on the front door, walking on the window, knocking on their window in the back. I can see them in their chair and wouldn't answer the door. So that was just, it was interesting to me. I also have a history of hearing loss myself. I wear hearing aids. And it's interesting. Audiology is so broad. There's a lot to it. It covers so much.
Well, let's just get started with what is the first sign of hearing loss that familiar, usually notice? What's that first thing where you say, I should probably talk to somebody?
What? That's it. What? The what?
Yeah.
So, the what is the thing. Some other common things where you might wonder if I need a hearing test or not. If you're in a group and you're having a hard time following all the conversation, you might need to have a hearing test. If you go into the dining room and you can't understand who's across from you or next to you, you might need a hearing test. So, 10 years ago, having a family member or someone in your friend group who had hearing loss was just kind of annoying. But now we know that hearing loss and dementia are very closely related. So, and they share, there are some things about hearing loss that it's gone. There are some things about hearing loss that affect your mental health as well. Hearing loss can make depression worse. It can make social isolation happen. where maybe you're not going to go to the dining room now because you can't understand what somebody's got to say. You're always frustrated.
Right.
And that's really what I hear every single day. And there's just so many other things that can be helpful to people. Hearing aids is generally the fix, right? Sometimes I'm just cleaning ears and that's enough. But honestly, hearing aids are an easy fix compared to social isolation, depression, and an increased chance of dementia. So
Now, why is it? I understand. Like, if you start to lose your sight, right? You might have to get a stronger prescription, and with a hearing aid, there's a lot of adjustments that you have to do. I know, but is it still? It's just not something that can be cured.
yes, so there is some very interesting studies being done with stem cell. So I'm going to tell you that it's a good thing I'm old, because my job might not be here in 15 to 20 years, because they might perfect stem cell so that your kids or my kids won't have this as an issue. But for right now, hearing aids is the best thing, because when you have hearing loss and you only hear a partial amount of the message that somebody's telling you, your brain starts to get a little lazier and a little lazier if you don't wear hearing aids. That's where it comes in, that little bit of laziness that occurs on the brain level. And that causes some cognitive decline. We don't need any cognitive decline. We didn't have cognitive decline in our 50s. We didn't have it in our 60s. We don't need it in our 70s, our 80s, our 90s. We need to be with it.
Yeah.
And hearing is the thing. You see it in your friends groups. You see it in your families probably too. Super interesting.
Yeah, and I know that the technology has changed so much. I mean, it's such a you can get a $50 hearing aid on Amazon that's going to be squealing and all this, and then you can get them all the way where they're tuned and on your iPhone and everything else, right?
Their hearing aids have changed so much just in the last 10 years that I've been involved. And the ways to get hearing aids. There's a whole change in insurances now where a lot of people have a Medicare supplement. A lot of the Medicare supplements have a third party that will get them a reduced price hearing aid. It comes with the doctor's services and stuff like that for at least a year. If you get your act together and you're able to get it together for a year, you don't have to see me again for like 3 years. But know that an over-the-counter hearing aid is good for somebody who maybe just started noticing they're going, what? That's a good hearing aid for that stage. Anything past that, if you're noticing it's difficult in the dining room, or you're noticing that you can't follow all your friends in Mahjong or something like that, then that is probably your hearing is deteriorated to the point where you would need a prescriptive hearing aid. And that's the difference. There's over-the-counter and prescriptive. Anything that you can buy in a store that you don't buy from a doctor or a hearing aid specialist, those are going to be like a hearing loss that is about a mild hearing loss. Anything more than that, you need a better hearing aid.
Now is it? Is there something about there's actual tones, like you can actually pitch a hearing aid to listen for certain tones or not? Is that what it is?
Exactly. So a hearing aid doesn't just an amplifier, something that you buy over the counter, will amplify all the sound that you're hearing right now. My voice, your voice, and people talking over there. But an actual hearing aid, once we do your hearing test and we know that in these high frequencies your hearing's way down here and not here, we can set your hearing aid so that it's working for this sound that's out here, this high frequency sound. A lot of people have an aging hearing loss includes mostly a high frequency hearing loss. And that means that the F, the S, the TH, the PH, the T sound, all those soft sounds that occur at the end of a word, especially in New Jersey where we clip the end of our words. So all those soft sounds make the difference in speech. They make the difference between the path and the pass. Those things are very fine sounds. And if you can't hear that, if that jumbles for you, then you're missing out and you're getting the wrong message. When you're seeing your doctor and your doctor has his back to you and he's talking and he's typing away and telling you what you have to do and how you have to take this medication and you have to follow up with this guy and you have to follow up with that guy, but you can't understand him because his back is to you, that's a problem. These are important things that you need to be taken care of. I know hearing aids, historically, everybody felt like they were going to be old because they were wearing hearing aids.
Yeah,
well,
the
guess what?
stigma.
We're lucky enough to be old,
Yeah, right?
right? So we should be able to do it the best way possible. And the best way possible is to have all of your faculties. If you couldn't see well, you'd wear glasses. I don't understand
Yeah.
the difference, but I think it's a stigma that's going to
Yeah.
go away. I mean, it's
Definitely.
getting lessened and lessened.
Now, do you find that like will over time will everyone lose their hearing or?
So I'm going to tell you some statistics. So at 50 years old, about 50% of the people could probably start thinking about hearing loss.
Wow.
At 70 years old, about 70% of the people should be thinking about hearing loss. At 80 years old, about 80% of the people. So that's unfortunately how the numbers go. And there's a lot of stuff that works into your hearing loss. It can be your family history. It can be the noisy job you had. It can be your diet. It can be heart disease.
Your diet.
Yep.
Yeah.
Hold on, hold on, hold the
Yep.
phone.
Yep.
We got to talk about the diet.
Yeah.
Yeah.
The
Really?
diet is a big deal.
Really?
Yeah.
So what should we be eating so
You
we can
should
hear?
be eating a healthy diet.
Oh, really?
Yeah. Because heart disease and diabetes contribute to hearing loss.
Oh, okay.
Yeah.
Interesting.
So when I start testing someone's hearing, if I didn't do a thorough history before I got started, because sometimes we just start talking and we get moving right into it, right? I will stop a hearing test to say, hey, do you have heart disease or diabetes? Because I can tell by their hearing test they do.
Wow.
It's interesting.
Wow, that is really
Yeah,
amazing.
it's really interesting. Like I said, audiology is very broad-based.
Yeah.
There's a lot to do as an audiologist. It's really
No.
interesting.
Now, what about the decibels? All right, so like my watch is constantly telling me I'm in too loud of a place.
And you are.
Oh, I know. I'm pretty much. I mean, I'm kind of guessing that. I mean, most places are.
Yes.
Most places are too loud for us.
Yes.
So, you know, when I go on stage, I always have earplugs.
Mm-hmm.
I always have earplugs in, and you can hear better. But I have custom-made ones. You know, it's a little bit different. And my kids, whenever they're there, they have to wear them too. Just because my dad, I feel really bad for him because he misses most of our conversations, and he's proud enough to pretend he's not.
Right.
And we don't realize it until he repeats exactly what we just said back to us. So, you know, but what else can you do? I mean, like, is it just a matter? And is there, if, you know, sometimes when your ears are ringing, I know that that's bad. Is there anything should you drink more water the next day? Is there any way to kind of help or be in a silent room? Like, what would your
Do you mean like your ears are ringing because you went out and it was really loud out that one time, or that your ears are ringing all the time?
No, like let's say you go to a wedding and the DJ's
Yes,
slamming the
that
stuff
should
the
get
next
better.
day.
That should get better over a day or so.
Okay.
As a matter of fact, if I am noticing someone's hearing is a lot different than the last time I tested them, I'll ask them, what have you done over the weekend?
Okay.
You know, and a lot of times they've been to a wedding, and it really does decrease their overall hearing for a couple of days. There's another kind of hearing of tinnitus, though. That's a temporary tinnitus. There's a long-term tinnitus that actually starts invoking a neural change in your brain that has to do with hearing loss. People who can hear a hissing sound all the time or a whirring sound all the time, those sounds, when they're hearing them, that's actually a neurological change that your brain is already making due to hearing loss.
Wow.
Yeah.
Because Oh, all the time? Or like for periods
There are
of
people
time?
who hear it, you can have it intermittently,
Okay.
but you can also have it all the time. All the time is generally hearing
Yeah.
loss. Intermittently can be from other biological changes that are going on in your body.
Wow. I mean, it is definitely, it's an intriguing thing. And I mean, and
interesting.
But you had said earlier how our brain can get lazy. Is there a way for us to, like, for instance, okay, so my dad, he's very good at reading lips, you know, but are there things, exercises you can do to maybe wake the brain up a little bit?
Sure. So in my practice, we will test people's hearing. If we find out that they have some hearing loss, but they're not really going to do anything about it right now, we send them home with a program called LACE. It's something that my office pays for. And so there are a bunch of different rehab programs that you can do either on your phone, any kind of memory game that you can play on your phone, or playing cards with friends, or any of those things are really helpful for brain function.
So just like memory games, there's nothing audible. Nothing with you're listening. It's just mostly.
So the one program that I just mentioned, the LACE program, is something that it's actually oral rehabilitation, hearing rehab. You listen to, and you can do it every single day. You can get a subscription just really by having a hearing test, because I throw it in there. I'm already paying for it. You might as well use it. But anyway, yeah. So an oral rehabilitation program is really helpful for that.
And so Doctor, how do people get in touch with you? Where are you out of?
So one thing before that.
Okay.
There's a few different ways to get hearing aids that are really helpful. So if you have a Medicare supplement program, that usually gets you a low-cost hearing aid, a lower cost to purchase a hearing aid. There's a program in the state of New Jersey for people who are over 62, whose income is under $53,000 a year, not their assets, but their income, and a lot of people fit into that. The state of New Jersey will provide you with a free refurbished hearing aids. Pair. And I'm going to tell you, I'm one of the only doctors there's a few doctors in the area that do it. I'm the only mobile doctor for the state. So I travel the entire state providing hearing aids for people through the state of New Jersey. And everything that I've given out has been a premium hearing aid.
Oh, wow.
Yeah.
That's
so
great.
A lot of times, because I see people at home, they get a basic hearing aid. They're only talking to their caregiver, maybe their kids. So we get them a basic hearing aid. But these hearing aids from the state, they're getting premium every time. It's awesome. So there are a few good ways to get hearing aids. And that's always a question that comes up when I talk. So I wanted to mention.
Yeah, no, and to that point too, because I know when we were talking about the over-the-counter hearing aids, when I had to buy one for my father-in-law, I was learning that there are some Is it the battery life that is, what makes one more expensive or better besides that pitching?
Great question. It has to do with technology. So an over-the-counter hearing aid that you can purchase just like at Amazon or CVS, to get one of those, it would work if you had a mild amount of hearing loss. So a mild amount of hearing loss is somebody who, I have a mild amount of hearing loss. It's somebody who can pretty much function but might miss a word here and there. That's about the only person who that fits. And my only worry when they started selling over-the-counter hearing aids, because that was a big deal in my profession, like everybody, all the doctors freaked out. It wasn't a big deal because the only thing I worried was that people would try an over-the-counter hearing aid and think that all hearing aids work like that, and they don't, right? But they don't. And I see a lot of people now who will tell me, I tried that. And I say, how long ago did you try it? And they're like 3 weeks. I'm like, call them, send it back. So you can get your money back. Because in a month, you can get your money back.
Yeah.
Right.
So anyway, yeah. So that's how that occurs. But to get in touch with me, my office is in Whiting.
Okay.
I'm Dr. Laura Padham. If you Google mobile audiology, if you go downstairs, go down the hall and see Dana,
I love it.
I'm all over the TVs here.
And is there a number that we can?
Yeah, my phone number is 732-691-1204.
And you travel all over?
I do the entire state. It takes me 3 weeks. Wow. I travel. I see about 100 patients a week.
Wow. So are you ever in your office?
I'm trying not to be, because I was a sprinkler lady, so
That's
I drove
right.
around all day long. I opened an office and I had to sit in one place, and I went, "Wow, I hate this." Yeah. So I was one of the first mobile audiologists in our state.
Wow.
But anyway, I pay a nice lady, another nice doctor, to sit in that office, and she does a great job. So we can see people in Ocean and Monmouth County very easily, but we see people for the entire state.
Oh, wow. That's, you know what? I really, really wish I knew you a little bit ago, because it's a huge thing to get somebody. You know what the other problem is that probably when you're in their home environment, that's really where you're going to be able to key in on what you want to give them, right?
Yeah.
To help them.
I can't tell you how often I sit on the couch. That's my office. My office is everybody's couch, right? So I'm sitting on the couch and we do the whole hearing thing. We finally get them their hearing aids. And the first thing they want to do is turn on TV and let's make this perfect for TV. And I get to sit there in live time and set everything up so that it's perfect for the TV. And then it's really usually pretty good for everything else too. But if you come in my office, it's kind of hard because you tell me you can't hear TV too good.
Right.
Right? Because what am I going to do? But yeah.
This is really fascinating, and thank you so much. But now
my
we got to play.
pleasure.
We got to play a game. I'm sorry,
boy.
it's Gail.
Gosh, I hope I do okay with
Oh
this
no,
trivia.
don't worry about it. You will be fine. And if you're not, again, we edit.
Yes.
Game time!
All right, so here we go. Actually, you've covered a couple of these things, so we're gonna see how we do here. So, to our audience, all right, the first sign of hearing loss is usually A, ringing, B, missing parts of conversation, C, turning the TV louder, or D, pretending you understand. Now, this is the first sign. Is it ringing in your ears, missing parts of conversations, turning the TV louder, or pretending you understand? Guys, what do you think? Is it ringing ears? What about missing parts of the conversation? They were listening, weren't they?
listening.
So that is 100% correct. Everybody out there, well done, well done. And well, the other ones, of course, are parts of it. But yes, if you're missing parts of the conversation, that's the beginning stage that you better get something checked out. Let's see here. What we got? Modern hearing aids are most like A, giant beige bananas, B, tiny smart devices, C, walkie-talkies, or D, spy technology. Oh, this is an interesting one. So do you think that they're like, well, they're not like bananas. We know that. But do you think that they're like these tiny smart devices, walkie-talkies, or spy technology? You think, yes, tiny smart devices? That is correct. Tiny smart devices would be correct. Because, you know, your walkie-talkies, what's funny, though, is that some of those over-counters are just
That big.
yeah, I mean, they're really,
They are.
it's just amplifying everything, so it can sound like a walkie-talkie over there. So that, you guys get another correct there. And then one more, let's see, here we go. The last one. When should you get your hearing tested? A, when people mumble. B, when your spouse gets louder. C, when grandchildren sound like aliens. Or D, earlier than you think. That's right. Earlier than you think is absolutely the answer, you guys. Great job, everybody. How about a big round of applause one more time for Dr. Padham? Thank you so much. We're going to have your stuff up there and check it out. We'll be right back.
You're listening to the Senior Scoop with Bob and Maria.
Really cool.
Thanks for joining us, and we will be right back.
Welcome back. You're listening to the Senior Scoop with Bob and Maria.
All right, everybody. It is your favorite time and our favorite time as it's Partners with
Now it's time
Prizes.
for Partners with Prizes.
Now, today we're going to be learning a little bit about what I'm very excited, actually, because we're talking about, this is a pharmacy. I know that you do some home care, but also this pharmacy that actually delivers all the way around. This is Marco, everybody, from My Ideas. Let's give him a big round of applause, please.
Marco Polo. Marco Polo.
I like it.
That's how everybody knows me, as a
Yeah.
Marco Polo.
Yeah.
And bingo, I hear too. You're the
Yes,
bingo man.
Hey, I'm the bingo man.
So Marco, tell us about yourself, please.
Sure. My name is Marco Polo. My name is Marco, but everybody called me Marco Polo. There used to be another person, that we used to go and do bingos together. His name is Paulo, but nobody knows how to pronounce Paulo, so they say Polo. So that's why we were Marco Polo. So I'm the best in bingos.
He really was. I used to work with Marco, and it was hysterical. It was like when you do bingo out doing marketing, it's very repetitive and hard to do, but he always made it fun.
I can tell that would be the
Yeah.
way. I got a feeling you're fun.
Yes. So we have a pharmacy that we do a blister pack or bubble pack or bingo pack because everybody has different names to it. Also, we do delivery all statewide. We do compounding medicines. Let's say there's a pill that you guys cannot swallow. We can convert it into liquid form. Right. So, yeah. And I know the insurance might not cover it, but that's not an issue.
So how does this work though? So if you've got a pharmacy, you go to your doctor, they ask you who your pharmacy is, they tell them where you are, and what's the name of the pharmacy?
DeRosa.
DeRosa?
DeRosa.
With a D?
D.
So DeRosa, and if then you because I know you guys, it's actually out of Newark is where everything is being
Yes.
happening. So how long does it take then for if I was to call on a script or something, how long would it take until it gets down here?
Would it be the same day?
Wow.
Yeah, it's in the same day.
Wow. And it's delivery.
It's delivery, free delivery, no charge.
And when you're saying these packs, so that they have the pre-packs for the medicine, and
Right. We do
Wow.
we do a pill box. Right now we change the form because now we have a robot that makes the pack, and it's telling you like what time you're supposed to be taking it in the morning, what kind of pill it is, color. So it describes everything of the medicine. Yes.
That's
now that is a humongous thing for someone. Now I had a home care agency.
Okay.
So I know that one of the major things is that home health aides cannot mix the medicine. So
Right.
if you're getting a pack that already has it, then it's okay. because
Exactly. Yeah,
That's
you just-
fantastic.
Cut the little package.
Yeah.
And if you want to travel it, you can take it with you. So you don't have to take the whole thing.
And that's really good because I know a lot of people get what we call medication management. They have somebody come in and fill their pill box.
Right.
So that's amazing.
Yeah.
I mean, and to have the the time in the day. I mean, I know sometimes I'm like, did I take my pill this morning? Did I? Is it in my pocket still?
Yeah.
So
Yeah.
How'd you get into this? How'd you get into the pharmacy?
I've been doing pharmacy since I was 17 years old.
Wow.
Mark.
17. And so was it always, did you just evolve with time to the delivery, or were you always a delivery pharmacy from the time that you started?
It's always been the
Really?
Yeah.
That's fantastic.
Yeah.
I wish I had known about you. That's fantastic. So and we got to get some details out there because this is what they ask, right? The doctor's going to ask for the name of the place. They're going to ask for the address. They're going to ask for the phone number.
Absolutely.
So give it to me. So it's Dorado Pharmacy.
I got everything in my bag.
Oh, in your bag.
the address.
I'm sorry.
Okay.
That's
No,
right.
that's right.
I
Do
can
you
give
have
it
the phone number?
Not
In the
my
bag. All right.
memory.
That's
Everything
right. You know
is in
what?
my phone.
Don't worry about that because I'm going to
Yes.
put it on the screen right now anyway, and you'll all
Yeah.
see it. So it'll
Yeah.
be great
All right.
when we
Perfect.
do
Thank you.
this. But so with the pharmacy, with the packs, let's talk about the conversion. Now, my father, I'm so happy he doesn't watch this all the time because I beat him up the whole time. But my dad cannot swallow pills. Like he just I don't know, ever since he was a kid, it's just something he can't do it. He can't do it. It really he's getting better, but he just can't do it. So what do they have to do? Because I mean, now it's so electronic, right? So the
Yes.
doctor calls in the script. How do you know it's got to be converted into a liquid form?
Doctor has to inform.
The doctor has to say that. Okay.
Doctor has to say, yeah.
Okay. Now, is there ever a time when the doctor would not? Well, I guess some medicines you probably can't. Is that possible?
There's some medicines that you won't be able to do it
Mm-hmm.
because depends on how they comes in capsules or liquid gels or tablets. So it depends.
Wow.
Yeah.
So, but as long as it can be, that's something that you guys
Yeah.
can do and handle.
Right.
And then, I mean, I guess there's always too like the pill crushing and things of that sort. Let me ask you a question. As a pharmacist, what is the best thing to put crushed pills in to make sure that you get most of it? I've heard applesauce. I've heard what do you think?
Apple juice.
Apple juice? Yeah, just
Apple juice,
put it in
that's
there.
what
and just
everybody
drink it
uses.
down.
Apple juice now. Yeah.
That's great. That's great. And I know that you're telling us about your pharmacy, but tell us about your home care company. You got a home care company.
Yeah, sure. Actually, we do a private pay. So, this company doesn't do any insurance.
Okay. Right.
So it's just only private.
Is that live-in or just
We
hourly?
can do a living or hourly.
And I'm
Yes.
sure the pharmacy must help a lot with that because of
Yes.
Yeah. And now the pharmacy is insurance. That's normal insurance.
Pharmacy
Yeah, that's normal. I want to
But
get to the problem.
also there is people that they don't have insurance, so we work with the prices. We are very low cost.
Speaking of that, when it comes to the prices, I've been shocked because I have Blue Cross Blue Shield, and for a while there, actually, my wife's a teacher, and the main reason that she was a teacher was for the benefits, which is now a joke because now we
Right,
pay
yeah.
about $1,800 a month for our benefits, which is great. But on top of that, now, for the first time in my life, now I'm getting denied for treatments and all that other stuff. But what I found was my RX is actually coming in cheaper than my prescription.
Yeah.
And
Good
Right.
RX.
Good RX.
Good RX.
My
It comes
yes,
in
good
cheaper.
RX.
Yes.
So, can you can you enlighten me? How is that happening? Because who pays them? How does that work? And you take that, right?
Yes, we do. But instead of using GoodRx, we use our own prices.
Oh,
Because sometimes with GoodRx, it will cost you more money
yeah.
than the value of the medicines.
So now, how do folks navigate that? Because I understand it when it's your business, it's one thing. I'm thinking I'm in the doctor's office,
Yeah.
and he says, "Who's your pharmacy?" Right? And I don't know what he's about to prescribe to me. I have no idea how much this thing is going to cost. What would you suggest to people to do in that situation? Because of course the first thing is, well, we'll see if there's a generic, and it's not like you're going to easily jump on your phone and look something up. So what would you say to people that, they're spending so much on their prescriptions? How do they navigate that?
Right. Okay. So when we receive the prescription, it goes through the insurance. When it's denied by the insurance, what we see, we check the price first. And then we can call the patient and inform and say, listen, your medication is not covered by your plan, but if you want to pay out of your pocket, it's going to cost you, let's say, $6, $7, depends,
Wow.
Yeah.
You're not going to get that at Walgreens. They're not going to call you.
No.
CVS is not
Those
going to
big
call
chains,
you.
Process.
yes,
Yeah,
they're just going
they're
to
just
say
gonna deny it.
it's
You gotta-
$200 and you
Yeah.
got to pay.
Wow.
Yeah.
So that's got to be great. You probably have clients that have been with you for a very long time.
Yes.
Yeah.
Yes, I do.
That's really that's a great thing to know. And so, I mean, it sounds like you're in this area quite often.
Yes.
In Ocean County and so.
I'm all stay away.
Oh wow, that's really great. So it's Dorado Pharmacy. I love this because I can't tell you, anybody who's on regular scripts. Now I run Caregiver Volunteers of Central Jersey. Okay. One of the things that kills us is we can get you to your doctor's appointment, but that's your ride. Now when you have to get your prescription,
Exactly.
this is a whole other ballgame. And if people can't afford to get themselves to the doctor's appointment, how do you think that now they're going to pay the extra money just to go to the pharmacy, with a taxi being average price $40 for 5 miles right now,
Exactly.
which is unbelievable. It is. We Caregiver Volunteers average this year. Okay, so we do not give rides more. We do 15 miles is what we do, up to 15 miles. The average ride in Monmouth County is $33. And the typical ride is 2 miles. Wow. 2 miles. And then in Ocean County, it's a little bit cheaper at $29. Now, this is through Uber, and this is per way. So now you round trip that, you're talking $50 to go get your script.
Crazy.
And that's if it's, and it starts, I haven't seen any price under $15 when it's on the same street.
Yeah.
So, this is one of those tough things where, when I say we, it's really a great idea to try to keep the roads safe and keep people off the road that might have a little vision issues or things like that.
Yes.
But then explain to me how they can eat and go to the store and go to the doctor. And I'm sure that there's a lot of people in this room. I know my dad's one of these people where, during the day, he feels comfortable driving. Yeah. And then as soon as it gets dark, well, what happens when it's dark at 4 o'clock in the afternoon? And this is when you have to go. So to be able to get your scripts from you, and not only get their scripts, but also have someone that you feel like is looking out for you. Okay, you got denied. Let me call you and figure out this situation. Yeah. That's really great. I think that's really commendable, and I appreciate you doing that. That's awesome.
Thank you. And also the compounding medicines which is really good.
What is that?
Compounding medicines, it's, for example, let's say you won't be able to take one medication. There is not in the market as liquid or swallow pill. Okay. We can convert it into a cream.
Oh, into a cream?
Yeah, I have.
Like a topical?
There's
as
very
a topical,
few compounding pharmacies.
Yeah.
I have a medication for my arthritis. It's 3 things. And it's like lidocaine, it's like a Voltaren type of thing, which are all individuals, but they convert it into a cream for me.
Right.
And
wow.
Super expensive.
Yeah.
So to have somebody that would discount it, I mean, I have a little tube. It's this big, $175.
What?
Yeah.
What? Now, do you have to have the doctor write for them to compound it?
Yes.
Okay.
Yeah, it's literally, it's like taking 3 different medications and putting it together.
Yeah.
Wow.
So
Wow, I did not know about
Yeah.
that. And it works. And now you were taking the pill, so it works the same or a little better
no,
or what?
So I was taking like a Voltaren pill for my arthritis, but the cream seemed to work better.
Mm-hmm.
But adding a little lidocaine to it helped more. So they do this compounding, and
amazing.
It is, but it's super expensive. So I only use it when I really hurt, because it's like I said, it's like less than 6 ounces, $175, but it really works, number one. But then again, there's not that big span. It doesn't last forever. You know what I mean?
right,
Like
right.
the expiration date is shorter.
Okay.
But to have a pharmacy that will work with you and that can do it, because the place that I had to send it to was in Chicago.
Oh, really?
Yeah.
And then that got delivered out to you
They
from Chicago.
overnight it, and you have to pay for the overnighting too.
Yeah.
Yeah.
Well, this
And
is
we have a free delivery for that.
Yeah.
And I should have asked that. So delivery there's a fee? Or
No, it's a free delivery. Free delivery.
How do you
That's
make money?
great.
How do you make money? I mean, listen. I'm thinking about what we pay for Uber. I can't imagine. I need drivers.
The cost of pharmacy, I mean, like really, it's
Yeah.
so high,
Mm-hmm.
and they make such a high markup on it that
Well, you know what the shame is too. It's like I still do use my neighborhood pharmacist because when I remember him personally driving scripts out when my mom was really sick. I remember that old feeling, like Campbell. I mean, he's
Yeah.
been there forever, and he would do that. He also would, give me my mom cigarettes when I was 5 years old, to bring out to her too. But and there's something about, yes, very often the hours of Walgreens I think about it, right? I can get my script at 10 o'clock at night. Our lives are busy. But then I think about someone like you that's actually taking the time to make a call and concerned about it. And, and we got to remember that. So, I mean, I really appreciate it. And the free delivery thing is huge. I'm gonna start getting you.
And also we have a DME supplies. Yes, that we can process through Medicare.
So the DME, that's like the masks and
Let's say walkers,
Walkers,
rollators.
What does it stand for? It's medical equipment.
durable medical
Durable medical equipment. Okay.
yeah.
Yeah.
Durable. What makes it durable? It's tough.
You can bang that walker around and
Do you guys do the rentals of things as well, or no?
No, we do. We process through the insurance.
Oh, very cool.
Yeah.
You must have a huge place up there.
Yes, actually, yes. It's kind of big.
Oh man. Well, this has been great. I really do appreciate it. I know that. So on the screen right now, you guys are going to see the phone number. It's Dorado's Pharmacy.
DeRosa.
DeRosa. See.
DeRosa.
We'll try that again. Dorado's is a food place, isn't it?
Yeah.
DeRosa's. So DeRosa's, and even though, listen, they're in Newark, but it's just like being next door because it's going to get delivered to your house. They've got a lot of different services that they can help you out with, and it sounds like it's almost like having your personal pharmacist back in the
Yes,
day.
absolutely.
And that's
yes.
really cool. So, well, with that being said, I think it's time to give something away here. So it is our Partners with Prizes.
Partners with Prizes.
All right, you guys. So get out your tickets. Get out your tickets. Tickets.
and you have brochures and you have stuff for me to leave.
So we have.
I didn't bring any.
Did you have any
Send it to me.
brochures or something?
Yeah, he's gonna bring them, drop some off to me.
All right, go in there. Pick one of these guys. 'cause I know that they're good.
Okay.
All right, now.
Here we go.
Today, the prize is $500 million, everybody. I might be off by a little bit. No, we got a gift card. All right, so 3, 6, 7.
Oh, you did? Okay.
5,
Then
1.
tell him. He brought 2 gift cards.
What?
Yeah.
2 prizes today, guys. 2 gift cards. All right, let me start over. 3, 6, 7, 5, 1, 3, 0, 3. Who's got 3, 0, 3? Oh,
There
we
we
got
go.
a winner in the back.
We got a
All
winner.
right.
We got
We
it.
got a
You
winner.
can sit down.
We
We're gonna
got
bring
a
it to
win.
You can bring
We'll
the
bring it
gift
to you.
cards.
We got
We're
one
gonna
more.
pick one
Here you go. Pick one more here.
One more?
Oh,
Oh,
yeah,
here we
yeah,
go.
Yeah. Oh, baby.
Here we go.
Baby. Let's see. Oh, this is funny. Here you go. 3, 6, 7, 5, 1, 3, 0, 1 this time. Oh, we got 2
there
winners
we
right
go.
next to each other. Give a big round of applause to all of our winners. And now, remember, DeRosa Pharmacy, and we're going to have some
Yeah,
we
we're
have
gonna
some
have
stuff out here that we're going to put,
Yep.
and on the screen you guys are seeing that. Do you have a website or anything?
Yes, we do.
What's the website? Do you know?
DeRosa.com.
DeRosa.com. All right. And how do you spell DeRosa?
DEROSE.
OSE. Ah, see that? So.
Oh no, I'm sorry. It's ROSA.
All right, I'm gonna be.
Oh
doing,
my God, I don't even know how to spell.
know-
I'm sorry.
I'm gonna be doing a lot of editing this time. So
Yes, we are.
DeRosa's Pharmacy, DEROSA.com. Is that right?
Yeah.
Yes.
DeRosa.com. That's awesome. So he's going to be giving out his prizes in a second. And you know
Yes.
what? I'm going to leave you guys a little different today than our normal leaving. So St. Patrick's Day is tomorrow. And in St. Patrick's Day, in the honor of St. Patrick's Day, for those of you that don't know, so I come from a huge Irish family. My uncle had a place called the Seagert Inn many years ago in Seagert. And ever since then, I was 5 years old when I first sang on the stage. And then I sang for a long time. And then I had to get a voice surgery like 3 years ago. And I haven't been singing since. But my mom and I did a song when we were kids, and then we did it together for a long, long time. So I'd like to do that for you guys, if you don't mind, as a little exit for this thing. But before we do that, give Marco a big round of applause, everybody.
Thank you.
All right, so I got to tell you the story about this song. This is actually kind of a funny story. So, do we have anybody Irish out there, by the way? Any Irish folks out there? Well, today, you do know in the month of March, everybody's Irish. And so... Oh, you could tell. Always B can get them every time, you know. Yeah. But there's so this song, it's called "The Fields of Athenry," and it's kind of funny. My mom was in. We used to. Do you remember they're the Catskills, and there were the Irish Catskills, and then there were the Jewish Catskills. Yes. Oh, okay. I'll wait a minute.
Is your mic on over there?
I think so.
Oh, yeah.
The Irish Catskills up in New York. They're right next to the Jewish Catskills. It's the same thing.
Yeah.
Yes, and so what happens is that every one of these places, and it's a very neat place to go on a vacation, because it's just like you're staying in these small places. Everybody eats at the same place, but the one thing that they all had is each we'll say. I would say complex, but each one of these hotels had a bar, interesting, and they had a contest where, you would go and you would sing. It would be a singing contest that they would do, and if you won, you'd have to come back at the end of the year and compete against everybody, and so in my family, this was a big deal. My mom would bring us to all these different places, and we would play. And so she won one year, and when I was walking around the fair there, it was called the place that we went to, it just escaped me, but I remember I learned how to play shuffleboard there. I love shuffleboard. I like the old shuffleboard, the pushing shuffle. And, it's right there. I can see it. Darn it, it's going to kill me. But in any case, yeah, so when she was singing, I was a real pain in the butt, guys. So my mom would give me piano lessons, and I didn't want the lessons because they were doing this. And I didn't want to do that. I wanted to play whatever the heck I wanted to play. So my mom yelled at me a lot, and she said, fine, pick out any music you want from this place, and you learn how to play that, and I'll give you a break. Okay? So I pulled a sheet music out, and it's a song called The Fields of Athenry. So now the thing was that growing up, my Uncle Bobby, so Bobby Byrne would always do Danny Boy, so I couldn't do that one. And my Uncle Jimmy would always do the Four Green Fields, so I couldn't do that one. So we started, my mom and I started singing this, and when I was really fortunate enough, I cut an album with her about 15 years ago. And we got to sing this, on stage, and we did a little bit of a tour, and even, it's very nice that now, my mom's been gone now, I guess it's going on 5 years, and I still have this recording. And so on St. Patrick's Day, what I do is every year I take out my part of the singing, and I do it live with her recorded voice, to do the thing. So this song it's a special song, and I do love it. And if you know anything about Irish songs, they're not really happy. Okay, so but this is one. It's basically a story of a man who's basically he stole some bread for his family in Ireland, and because of this, now he's going off to prison. And the old Irish stories, And it's a beautiful song, and I hope you guys like it. And if you don't, just don't tell me, all right? So let me see. Oh boy, I haven't sang this by myself in a really long time. So let's sing. By a lonely prison wall, I heard a young man calling. Michael, they are taking you away, for you stole Trevelyan's corn, so the young might see the morn. Now a prison ship lies waiting in the bay. Low lie the fields of Athenry, where once we watched the small free birds fly. Our love was on the wings, we had dreams and songs to sing. 'Tis so lonely round the fields of Athenry. Now here's the funny part. So when I would do this with my mom, right? And my uncles would always say, you know, Bobby, what key is it? Because we would never know. And I would say, it's in G. And my mom would make the distinction in the middle of the song of what part she was going to sing. Go up or down. And that's the way she would tell me. So we'd be singing in front of a whole bunch of people. She'd be going like this, and I'm trying to go up and down. It's just funny, the things that you remember, you know? Sorry. Let's see. By a lonely harbor wall, I heard a young man calling. Nothing matters, Mary, when you're free. Against the famine and the crown, I rebelled and they shot me down. Now you must raise our child with dignity. Low lie the fields of Athenry, where once we watched the small free birds fly. Our love was on the wings, we had dreams and songs to sing. 'Tis so lonely round the fields of Athenry. By a lonely prison wall, she watched the last star falling. As the prison ship sailed out against the sky, sure she'll wait and hope and pray for her love on Botany Bay. 'Tis so lonely round the fields of Athenry. Low lie the fields of Athenry, where once we watched the small free birds fly. Our love was on the wings, we had dreams and songs to sing. 'Tis so lonely round the fields of Athenry. Low lie the fields of Athenry, where once we watched the small free birds fly. Our love was on the wing, we had dreams and songs to sing. 'Tis so lonely round the fields of Athenry. 'Tis so lonely round the fields of Athenry. Well, I guess that's how we end the scoop this time. So, guys, thank you so much. We'll see you all at our 1-year anniversary next month. See you later, everybody. Good night.